welcome you to today's webinar on benefit solutions for public sector employers. I'm here with Karen Smitty, Benefits Specialist for the City of Arvada, Colorado. She will share with you the benefits design process the city followed and how combining a self-funded plan design with the Paladina Health Medical Home worked for the city. We'll also take a look at several other public sector employer case studies to give you a glimpse of what is unique about the public sector and what can be applied to the private sector as well. Before we get started, I'd like to introduce myself. I'm Karen Jurlide, Vice President of Business Development for Paladina Health. I've been in healthcare for over 20 years, leading operations on the provider side as well as serving on the health insurance carrier side of the business. So I'd like to introduce you to my partner in crime, Karen Smitty. She's here to share her experience in human resources and benefits that spans more than 20 years, 16 of which have been with the City of Arvada. I've been lucky enough to work with Karen for the past 2 years as we work to introduce Paladina Health to the city. On an administrative note, one of the best parts of tuning in live for our webinar today is being able to submit your questions for live answers. So I encourage you to submit any question you have anytime during the webinar, but the earlier the better. We will queue them up for the Q&A portion of the webinar. Just enter your question into the Q&A tab and click send at any time. This webinar will focus on benefits design for public sector employers and the unique factors that influence the benefits that are offered. Karen, can you speak to some of the factors that public sector employers like the City of Arvada are dealing with?
I'm happy to, Karen. First and foremost, I'd like to say that our goal at the City of Arvada is to control health care costs while providing the benefits our employees want and deserve. This goal informed all of our decisions. The public sector, being publicly funded, has significant pressure to keep costs low. We're stewards of the taxpayers' money, which doesn't allow us to simply absorb additional costs. And we're constrained to the extent that we can use cost shifting as a means to control costs. What we came to realize at the City of Arvada was that simply passing on the cost increases to employees didn't help us achieve our goal. So, along with many of my peers in the public sector, we've been looking for innovative solutions to control long-term health care cost growth and also provide benefits that set us apart as employers. As a result, many public sector employers are becoming laboratories of innovation in health care benefits design.
Thanks, Karen. The factors Karen shared are not unique to the City of Arvada. In fact, many employers in the public and private sector are realizing that cost shifting to the employee is no longer an option. On the screen, you'll see healthcare spending from a report by the Kaiser Family Foundation. As you can see, while the employer contribution has increased by 80% in the past 10 years, the employee contribution has increased by even more. And we're seeing a widening of that gap over the years. There is simply a limit to the amount of cost increases that both the employer and the employee can sustain. The need to solve the problem of healthcare cost increases isn't isolated to the public sector. What is unique to the public sector, however, is their typically higher age workforce and the higher cost health conditions that tend to come along with aging. The median age for public sector employees is a full 3 years older than that of the general working population. And when you consider AARP data that show 4 out of 5 adults 50 or older have at least one chronic condition, you can see how healthcare costs for public sector employers are typically higher, just by demographics alone. To compound that, our fee-for-service healthcare system does not effectively support proper management of chronic disease. So when I talk to public sector employers, I tend to stress the need for access to comprehensive care that focuses on chronic disease patients, both pre- and post-chronic disease diagnosis. This helps the employer control what can become a cascade of claims for them if not managed correctly. So let's get right into the case studies that you're here for. In addition to the City of Arvada, we'd like to share a few other case studies. The first is also a municipal employer. The PMPM, or per member per month, cost shown here is the organization's total combined medical and pharmacy spend reflected on a per member per month basis. We looked at the PMPM healthcare costs because this number gives us more insight than top-line numbers. For this municipal employer, the PMPM cost is about as high as I've seen, almost 40% higher than average, which is certainly a concern for the municipality. To achieve savings, the employer created an innovative plan design that included a lower premium plan coupled with Paladina Health. The plan design drives care to Paladina Health by making services free or very low cost, and in comparison, outside services cost significantly higher. How can the Paladina Health medical home model impact this employer's healthcare spend? Essentially, this is achieved by redirecting outpatient and specialist services to high-value, lower-cost providers, and better coordination of those services can significantly reduce this employer's claims. Our next employer is a public transit provider. This employer also had high PMPM costs that were higher than the benchmark, and chronic disease healthcare costs were also quite high here. And I'd like to point out that, according to the United States Centers for Disease Control, chronic conditions as a whole make up 75% of healthcare spending in the U.S. Much of that spending can be avoided by establishing a collaborative relationship with a primary care physician who is accountable for health outcomes and has the time it takes to work with the chronically ill patient, rather than a cadre of specialists who tend to treat symptoms from a more siloed perspective. In both of these case studies, we would recommend a medical home model to provide that comprehensive care that can improve health outcomes and patient satisfaction, as well as draw down chronic disease care spending. Now, if any of you are interested in more information on how claims data can be used in the benefit design decision-making process, or our view on caring for the chronically ill, I recommend viewing one of our recorded webinars dedicated to these topics on our website. We have worked with a variety of public sector employers, from school districts to municipalities, employers that run the gamut, and see the same thing time after time: high PMPM costs driven by chronic disease and inefficient access to the healthcare system. Once these employers recognize those problems and realize there are solutions like Paladina Health available, they take the next step that my friend Karen Smitty from the city of Arvada is here to describe.
Thanks, Karen. Like I said before, we tried a variety of approaches prior to arriving at our current benefits design. As we discussed, we have an older than average workforce, and we had been seeing higher than average healthcare cost increases year over year. This, combined with our having a fully insured health plan and the premium increases that plan was driving, was becoming unsustainable from a cost perspective for the city. Throughout this process, we were guided by our benefits design goal: controlling healthcare costs while providing high-quality benefits to our employees that reinforce our culture of wellness. This is a central focus of our city manager, Mark Devon, developing and fostering this culture of wellness. To support this goal, we had previously implemented wellness programs including biometric screenings and formal and informal programs with limited results. To give you an idea of our city, the city of Arvada is a first-ring suburb of Denver, Colorado. I'm a lifelong Coloradan, and I love living in Arvada. We have a strong culture across our community. And I can say that we aim to create that culture in the municipal government as well. So with nearly 1,600 covered lives and encouraging this community-wide culture of wellness, we were ripe for a change. Our benefits advisor, Hub International, an invaluable resource for us, presented an opportunity for an innovative and cost-effective benefits design.
Thanks, Karen. I'd like to share with you a high-level summary of the issues that were identified from the city's claims data analysis. When the city's benefits advisor presented Paladina Health as an option for the city, they reviewed the information you see on the screen. Consider that the overall claims costs were more than 22% higher than average, and dependent claims costs were also significantly higher than average as well. This, along with overutilization of higher cost places of service, represents an opportunity for savings. Just getting the city closer to average healthcare spending would provide significant cost impact to the city. Again, we have an entire webinar on claims analysis and ways to redirect care from high-cost environments to lower-cost, high-value environments. An example our claims expert shared in that webinar is relevant here and looks at how a person accesses the healthcare system. Are they not seeing a primary care doctor but showing up in the ER? Are they seeing specialists without seeing their PCP? Oftentimes when we see these high outpatient and ER claims, we also see a tremendous opportunity for savings. A 2012 study from the Archives of Internal Medicine found that 40% of emergency room visits are truly appropriate for the primary care setting. So by simply providing accessible and proactive primary care, we avoid that care going to the higher cost settings, which is where it's currently being delivered in most groups to a large extent now. Karen is going to offer some insights into how this played out for the City of Arvada, but before I turn it back to her, I'd like to remind our audience to type in any questions you have for us into the Q&A tab and click send.
Thanks, Karen. First, I'd like to say that our city manager is a visionary, and his leadership and support for innovative solutions has been key to our ability to implement this new strategy. Mark Devon really means it when he says our city employees are our #1 asset. He's a champion of our culture and also for the Paladina health benefit that is essential to controlling our healthcare costs. So let's take a step back. As an employer, it was painfully obvious that there was a need for change. I'm sure many of my peers in the public sector get stuck here, recognizing the need for change but not knowing what to do next. That's where a trusted benefits advisor is incredibly valuable. They saw the critical need, recognized our core value of innovation, and introduced the idea of a self-funded health plan paired with Paladina Health. Our acceptance of that recommendation really came out of two places. One, we knew we couldn't make incremental changes anymore. Raising deductibles and copays and increasing premiums year after year just wasn't working. We recognized it was time to take bold and comprehensive steps. And two, we had a trusted advisor. For an employer, public or private, moving to a self-funded plan design and assuming the risk of your employee pool is a big step. Our advisor provided extensive analysis and worked with our finance department to help us understand and feel comfortable that self-funding our plan in tandem with an innovative solution like Paladina Health was the way to go.
Thanks, Karen. And while many of you on the line may already have self-funded health plans in place or know what goes into making the switch, you may not know that almost 70% of companies with more than 50 employees are self-funded. And while employers know they assume the financial risk, it also gives the employer a larger set of levers to pull in controlling their costs and improving their employees' health.
And for us at the City of Arvada, we saw we would be saving money on health care costs if we chose the Paladina Health medical home. So then the question became, do we want to keep that money or do we want our carrier to save it? In the end, it came down to the two options working together, transitioning to a self-funded plan and introducing the Paladina Health medical home. Neither made sense to us without the other. Making the switch to self-funding opened up the possibilities of bold, comprehensive changes to the way we deliver care to employees. We learned something incredibly important at this point in the process that I'd like to share. While many approaches are out there, from incentives to disease management and more, very few are truly bold or comprehensive, and few directly impact employee independent health, satisfaction, and cost of health care. Here's an example. For us, an on-site clinic that triages our employees with a physician's assistant or nurse felt redundant. Our plan already covered urgent care visits. We wanted to offer a way to provide high-quality, accessible, and affordable health care provided full-time by a physician who could help our employees identify and achieve positive health outcomes. So at that point, we realized that Paladina Health's physician access medical home model was a better fit for us. It's both bold and comprehensive in terms of how it changes the way healthcare is consumed by our population. By connecting our employees to the Paladina Health Doctor and the convenient clinic locations, we're able to easily manage their overall health and well-being in a way that the traditional healthcare system cannot. And this bold and comprehensive approach was in line with our goal to reduce healthcare spending, provide high-quality benefits, and promote our culture of wellness.
The distinction between these types of programs is incredibly important, Karen. Without a comprehensive approach to health and wellness, many employers miss seeing results, public and private sector alike. In fact, a recent RAND Corporation study showed that about half of all employers in the U.S. offer wellness programs, but results are seen in very few of these programs, typically those targeted to aggressively manage chronic disease. Many of you are familiar with Paladina Health, but for those who aren't, I'd like to give you a quick introduction or refresher. We are an employer-sponsored medical home and deliver high-quality healthcare services through both on-site and near-site clinics, as well as 24/7 cell phone access to the physician. We've realigned incentives so that our physicians are held accountable for delivering great care and excellent service, not for billing as many claims as possible. Through our program, employers add a new physician option for plan members to their existing benefit plans. While this model delivers higher quality care and employee independent satisfaction, it also drives down healthcare costs in 3 powerful ways, which you can see on the screen now. Most employers see first-year savings, although this can vary a bit based on several factors, including demographics, disease prevalence of the population, and the incentive structure they put in place to incentivize utilizing Paladina Health versus outside services. This results in patients having access to a cutting-edge benefit that improves health and productivity. Certainly employers who offer this benefit get a differentiated benefit that improves retention and employee satisfaction. And the outcome for both employers and employees is lowered healthcare costs. Also, just a quick reminder before we move on, please feel free to ask questions throughout the presentation so we can have them queued up for the Q&A. We've already had some great questions come in. Just type any questions you have into the Q&A tab and click send. Now I'm turning it back over to Karen Smitty for details on what the city did next. I think this next step is truly essential for any public sector employer.
You're absolutely right, Karen. The next step we took was to build a consensus around our benefits changes. This was critical for us. For our employees, and this is likely true for both the public and private sectors, benefits have been shrinking over time. When an employer shifts costs to the employees, the outcome is lower benefits for employees. So before introducing this bold and comprehensive approach, we wanted to be sure employees would see it for what it was, a wonderful new benefit, a new and exciting opportunity to have better access to health care, to be better served by health care, and in the end, an opportunity for our employees and their families to be healthier. So we gathered together a group of stakeholders from a cross-section of city departments. This allowed us to take a thoughtful and methodic approach to evaluating and rolling out our benefits package by getting input and buy-in from all employee levels from the very beginning. Our goal was to have broad support among employees and ensure they understood this was an enhancement to their benefits while providing a financially sustainable solution for the city. It was critical that we were building consensus throughout the entire decision-making process. For us as a public organization, it was extremely important to do our due diligence and carefully consider all of our options and to be transparent in sharing the results. As I said before, these changes, both self-funding our health plan and introducing Paladina Health, were bold and significant. We did not take them lightly and worked with our stakeholders to ensure they understood them at every step.
Thank you, Karen. As we discussed earlier, the issues identified in the city's claims analysis revealed the following problems shown on the left side of the chart on your screen. Many employers see similar problems in their claims data. The question becomes, what do we do with this information? And the real questions are, how do you eliminate unnecessary trips to the ER? How do you lower outpatient and inpatient claims while providing the services your employees need? How do you essentially change the way healthcare is delivered to ensure it is provided in a more efficient way? Below on the right, you can see how the Paladina Health Medical Home addresses those concerns. By directly providing 85 to 90% of most people's healthcare needs and staying accountable to guide the remaining 10 to 15% of needed care in the outside system, we can fundamentally change the way healthcare is delivered in a more efficient and cost-effective way.
And then, after crunching the numbers, working with our advisor, visiting a Paladina Health clinic, and more, we just had to have the courage to say, we just have to do this. We can't keep doing what we've been doing. It's not working. And we can't keep tweaking the plan. We have to go bold and have the courage to commit ourselves to a new idea. And we were excited that we discovered a method of delivering health care that made so much sense, from a financial perspective, but most importantly as a means to provide outstanding, affordable health care to our employees and their dependents. And right now, 3 months in, the feedback we're hearing is very positive. About a month ago, I received this email from one of our employees. Karen, I just wanted to share. My husband awoke this morning with his foot bothering him. He gets these flare-ups from time to time and had diagnosed himself with what he thinks it is quite a while ago. Because he was such an unhappy camper this morning, I talked him into going into the Paladina clinic. He called when they opened and got an appointment with Dr. Brown at 11 o'clock, and he got a real diagnosis. He was so glad that he had all the time he wanted to spend with her. He said it was the best experience he's ever had. We're so rewarded to see this decision is paying off. At 3 months in, we're nearing 50% enrollment for all eligible employees and dependents. We also have data that show nearly 70% of patients feel their health has somewhat or significantly improved. This is something that improves our culture and our employees' lives. And that was our goal when we made the decision to completely rethink our benefits design.
Thanks, Karen. The City of Arvada really is an excellent case study of how benefits design, organizational culture, and employee health dovetail to produce significant results. And the real lesson here is the power that employers have to control their healthcare costs and enhance their employees and their families' health and well-being through smart, bold, and comprehensive benefits design coupled with this innovative medical home strategy. For those of you who are interested in more detail, I invite you to call or email your Paladina Health contact, including me, or email Kelly Bryant at kelly.m.bryant@paladinahealth.com to get a white paper that neatly summarizes how the City of Arvada and their benefits advisor work together to make this happen. Also, I encourage you to reach out to your Paladina Health contact if you have any questions about what we've covered here today. We've saved a few minutes for questions here, so as a reminder, you can type your questions into the Q&A tab and click Send to ask a question. Karen, we have a question that has come in from one of our viewers, and it is for you, so I'll read it now. You mentioned that you have been working for 2 years to introduce Paladina to city employees. How long has the city offered Paladina? How long was the implementation process?
We have offered Paladina. Our clinics actually opened, our near-site clinic opened in late February, February 24th. And our other clinic, which is about 7 miles north of the city, opened the second week of March. So we've been open about 3 months. The implementation process was really pretty quick, and particularly when you remember that we're a government agency and things often move slowly. For us, this was a real quick decision. I believe that we visited the Paladina Clinic in downtown Denver last spring, in spring of 2013. And I can tell you that our city manager, Mark Devon, was on that visit, and if he could have signed on the dotted line and got our clinic started right then and there, he would have. But obviously, we had to do our due diligence. We went out to bid. We had about 5 clinic providers bid, in May, and we interviewed about 3 of them. We did sign the contract with Paladina in September, and then we started talking to our employee groups right away. And even before that, many of our employees were involved in that bidding process and the interview process. But after we signed on the dotted line, we started really talking about the clinic and how it would work. That worked very nicely into open enrollment time, which for us is in November, that we talked about it some more. And then in January, after the holidays, we had more meetings and talked about it even more. And we had opportunities we had some evening meetings so spouses could come. We videotaped one of our meetings so folks could take home a DVD and share it with their families. So I think the implementation process really went very well for us.
Great, thank you. Thank you, Karen. Here's one question I'm sure many of you are wondering. Have you been seeing cost savings results from your benefits design change? Karen, can you share some insights from this early stage?
Well, when we made the decision to switch from fully to self-funded, we took that approach because of the Paladina health options. As I said earlier, we knew we were going to save money, and we wanted to reap the benefits of that savings. We didn't want to pass that on to our carrier. The savings and the trend containment that go beyond that could be associated with Paladina Health. The bottom line is every time we can avoid running a claim through our health plan, everybody saves money. So I tell employees all the time, every time we use the clinic, instead of going to our own private doctor and generating a claim, we're all going to save money. And that seems to really resonate with our employees.
Right. I have another question here for you, Karen, and it follows up from the previous question. If you were fully insured before, how are you going to isolate the Paladina health savings versus the self-insured savings?
Well, I think for us this is really kind of a long-term goal. We know that initially we have an analyst who's looking at our claims on a monthly basis, and so far things are going well, and they're exactly where we hope them to be. But again, we know that we're very early in the year. We have to have more experience in order for us to start to see the true cost impact for us. And I think it's important to remember that this is a long-term solution to impact a very long-term trend. We've been seeing these double-digit increases for many years, so we know that this is not going to be an overnight switch. But we feel like in the 3 to 5 year time frame, we're going to be able to track against our benchmark, and we're going to see some pretty good results.
Great, thank you, Karen. Another question that came in that I'll ask you to answer, Karen, is you mentioned how enrollment is increasing at the city. Do you have a different contribution strategy for employees if they enroll in the Paladina model?
Well, we do that as kind of an incentive. So everyone pays, this year everyone is paying the same premium. The city is paying the Paladina fees. But for 2015, and we've told people from the beginning of this year, they've got all of this year to accomplish this, they can save some money on premiums next year by doing a couple of things. If they choose to go to their own personal physician and get a physical, and they bring us a note from that doctor just saying they were in their office and the date, obviously we don't want any kind of results, they're going to save $10 per check or $260 on their premium in 2015. However, if they go to the Paladina clinic and get their physical there, which by the way is an hour-and-a-half appointment, then they're going to save $20 per check in 2015. So that's a savings of $520 over the course of the year. So that's how we're financially incenting employees to go. And I think the other incentives are people are starting to hear about what a great experience it is. They don't have to wait. They have a long appointment. They have lots of follow-up. So obviously those are working as incentives too.
Definitely. Great. Thank you, Karen, for that answer. And we have questions rolling in, so we're just teeing up the next question, one of the next questions is, how do you demonstrate with the Paladina model the quality of care that's delivered? And I think there's really a kind of a summary of that demonstration is present in our reporting that we provide to our employers in terms of, first of all, engagement, how many employees are engaging in the model, how many are getting in for their physical, are they engaging virtually by cell phone or telemedicine in a sense, or in person, and then moving on to the health measures or the outcome measures that we're very specifically focused on for disease management, things like diabetic control, hypertensive control, and control of hyperlipidemia. So it's very important to us to get a baseline of those, kind of that status of the population, and begin working on those measures from day one. Another piece of kind of our quality measures has to do with how we are tracking over 40 HEDIS measures, or common measures of needed preventive care. And we are looking not only at how our population is stacking up from a variety of those measures, things like colonoscopy screenings to mammograms to kind of other needed screenings against kind of the standard kind of HEDIS measures, but also we establish a higher measure for our own organization, and then we're able to kind of measure our results over time based on those measures. And kind of the last piece, or another piece, is patient satisfaction. We think it is highly important that our patients see this as a really insanely great or phenomenal healthcare experience. That folks that are very positive about the experience of healthcare that they receive are more likely to engage in wanting to make healthcare behavior changes or to adhere to their kind of healthcare plan. And so we report on patient satisfaction as well, based on using the Net Promoter Score. All of our physicians actually are incentivized based on their own Net Promoter Score. Our physicians are also incentivized based on the outcomes, as I mentioned, the chronic disease outcomes, and also financially incentivized on their patient engagement as measured by the % of patients who receive an annual physical. So we are tracking, I think, our performance and the quality of services, not only in terms of care measures and outcome measures, but also in terms of satisfaction measures. And another question that we have is, how would you describe the city of Arvada's health plan type prior to introducing Paladina Health?
I can take that one, Karen. To be honest, it's the same as it is now with the clinic. So we have an HMO type plan, which is basically deductible and coinsurance if you're hospitalized, co-pays for everything else, doctor visits and urgent care, emergency room, and so forth. And then we also have a high deductible health plan, which the city helps to seed the HSA account. And I think, and this was important for us to educate our employees on, was that the Paladina Clinic does not replace the health plan. It doesn't impact it. It doesn't say you can't go to your own doctor anymore. You have to go to the Paladina doctor. We had to be very specific to tell people this is in addition to your health plan. We recognize that people have long-standing relationships with doctors that have seen them through good times and bad, and we certainly are not wanting to get in between that and enforce people to go to the clinic. But we also knew that we had a large number of employees who either didn't have a doctor or had a doctor but didn't really like him, couldn't ever get in to see him, always saw the physician's assistant, never saw the doctor, and that this would be a great opportunity for them. So the clinic, though, is in addition to our standard medical plans.
Great, thanks, Karen. One of the follow-up questions to that is Paladina offered by the city as the only option or one of several? So it's really an option that you have on your various health plan benefit plans.
Right, yeah. Employees have to be enrolled in one of our health plans, either our HMO or the high deductible, in order to join the Paladina Clinic, because obviously the city's paying the fee for that, so we want to be able to see the savings in our own health plan. But it's certainly, it runs in tandem. If you are a member of our health plan in either of the two plans, then you're automatically can become enrolled in the Paladina Clinic.
Right, thank you. Another question is, and I'll start with this one. If you want to add anything to it, Karen, feel free to. How do you control cost if a large portion of the population uses the ER? That's a great question, because obviously from the data we knew that a large portion of the population, or there was a lot of utilization of ER in this group. And what our model does is it really changes the way people are accessing health care. So when we begin to engage patients in the Paladina Health with a physician, what we see often is pretty significant utilization of ER decreases. So the physician can do that in a couple ways. Number one, because they're available same or next day, appointments last as long as they need, people are able to get in and work with their physician on things that then don't become an issue in the ER later on. Also, people can always reach their Paladina Health physician by cell phone 24/7. So, a lot of times you have a situation where maybe somebody, is not sure, is this fever serious enough to go to the ER? Maybe a child has fallen and there's some blood and we don't know if we need stitches. And so, the natural default is to just go. If you have a physician that you know, that you trust, that knows you and your medical condition, and you call that physician and they say, hey, let's try, these steps before we go to the ER. It's medically appropriate, and they're, really they're going to kind of do the same thing. Or, hey, yep, we don't need stitches on that. Go ahead and use a butterfly bandage, and see me in the morning. A lot of times those visits that really aren't necessary can be averted or just taken care of by the physician themselves.
Yeah, I would agree, Karen. I think that 24/7 access is huge, and of course a lot of employees don't believe it. How can that happen? How can a doctor be on call essentially 24/7? And of course it all ties into the lower patient panel, because the doctors have such a smaller panel to take care of. They really aren't getting as many phone calls as you might think. And technology is a huge piece of that. We've used the example, if you wake up on a Sunday morning and you've got this weird-looking rash on your arm, you can take a picture of it, text it to your doctor, and say, hey, what do you think? Do I need to run to the emergency room? And the doctor may come back and say, nope, let's try X, Y, and Z first. And if that's not better, then yeah, let's go to the emergency room, but I think we can get it under control by doing this, and then I'll see you first thing in the morning.
Right. Thank you. Thank you for that. Next question is, can the City of Arvada's employees voluntarily enroll in Paladina, or is it mandatory?
It's absolutely voluntary. We would like for folks to enroll who think they might at some time use the clinic, because that helps us see how many patients are assigned to the doctor. It helps Paladina to determine if they need to start thinking about adding another doctor to our clinic locations. But it's absolutely voluntary. Again, we certainly don't want to get in the middle of someone who has a long-standing relationship with a beloved doctor. So it's certainly voluntary.
Great, thank you. Another question is, does the City of Arvada use an on-site Paladina clinic or a near-site clinic, or a combo of both?
Well, that's a great question, Karen. Obviously, the Paladina model with the clinic, the employer clinic, is on-site. It's on the campus. And that's what we started with. However, our campus is getting ready to go through some pretty big changes. We've located our police officers to substations, and there's going to be quite a bit of remodeling. And so we were advised by our facilities folks to find a place close by and lease it for maybe the next 5 years. And then as this new campus is being planned, our on-site clinic would be part of that model. So that's what we did. We're about a half a mile west of City Hall on the major street. We found a very nice office that's already in a medical facility. Our facilities folks helped us remodel it, and it's beautiful now. It really has become a lovely place to be. And now that we're there, we're kind of glad it worked out that way, because what we're hearing employees say is they like to go there. They may not be as willing to come somewhere on-site because they're concerned about people seeing them. They're concerned about running into a coworker. They're concerned about, you know, someone looking out their office saying, "Ooh, gosh, I see Mary's going to the clinic again. I wonder what's wrong with her. That's the third time this week." I think from a privacy perspective, having it very close to our campus but not right on our campus has just worked out to be a great decision, and it may be something that we continue on now going forward.
Right, and it is a beautiful, you have two beautiful clinics, so that's a nice place for folks to go and receive care. We have time for, I think, one additional question, a quick question, and unfortunately we won't get to everything today. We appreciate everyone submitting their questions. Last one is, was collective bargaining involved?
No, we are not unionized at the City of Arvada.
Mm-hmm. So that is, unfortunately, all the time we have for today. I'd like to thank everyone for joining in on the webinar, and of course thank Karen Smitty for her time today. This webinar was recorded and will be available online at www.paladinahealth.com/webinar replay later this week. Also, please join us for our next webinar, Innovation in Healthcare, Organizations Across Healthcare Taking New Approaches to Improve Care and Lower Cost. The webinar will take place on August 27th at noon Mountain Time, and will feature panelists from across healthcare to shed light on innovations happening right now and share insights into what's on the horizon in healthcare. You can register for that at paladinahealth.com/webinar. I look forward to seeing you on future webinars. Thank you for joining us.